Hi, my name is Monica, and I'll be your nurse today. And what's your name?
Cameron,
Nice to meet you, Cameron. And how old are you?
18.
All right, today you're here for a general assessment and an inspection of your head and your neck. I already started asking you a few questions. I just have a few more questions for you. Can you tell me who the president is?
Joe Biden,
Okay, and who was the former president?
Donald Trump,
Donald Trump, very good. Also, can you tell me the day of the week?
Monday.
Monday. I'm looking at your clothes. Your clothes are clean. I don't smell any odor, so that tells me that you have good personal hygiene. I'm also looking at your posture and your position, which is very erect. And I also looked at, when you walked in, your mobility. You didn't have any unsteadiness. Your gait was normal, and I didn't see you using a device such as a walker or a cane. Do you use any of that?
No.
Okay. Also, I'm not looking at any physical deformities. Do you have any of those?
No.
And can you tell me your mood today?
Happy.
Perfect. Love to see when you're happy. So what I'm going to do first is I'm going to clean my hands, and I'm going to start at your head and your scalp. I'm looking at your hair. I'm noticing that your scalp is clean, dry, and intact. I'm not seeing any dandruff, any kind of flakes, any redness. Your hair is black, and I'm noticing that it's coarse. I'm gonna push and tell me, do you feel any tenderness?
No.
Okay, perfect. Now I'm gonna assess your sinuses. I'm gonna use my two thumbs. This is your frontal sinus, and this is your maxillary sinus. Any tenderness noted with that?
No.
All right. Now I'm looking at your eyes. I'm noticing that your two eyebrows are symmetrical and both of your eyes are symmetrical. Can you close your eyes for me? I'm assessing your eyelids and your eyelashes. I'm noticing that they are both symmetrical, no redness, swellage, or drainage. You can open your eyes for me. Now I'm gonna check your pupil reaction. I'm gonna hold the light up to you and you'll see a light. And just look straight forward for me. Perfect. And on the other side. All right, now I'm gonna check your accommodation. If you'll look straight ahead at the light, then look at the wall behind me, and then back at the light. And your accommodation is good, so that's good as well. Now I'm looking at your nose. Your nose is symmetrical. I don't see any redness, swelling, or drainage. I'm also looking at both ears. I'm not noticing any redness, swelling, or drainage. I'm gonna press and palpate. Do you feel any tenderness?
No.
Okay. I'm also looking at your lips. I notice that they're moist. They're pink and moist. I don't see any lesions, any cracking or anything. And I'm looking at, when you were talking to me, I noticed your speech, and your speech is very clear, so that's great as well. Any questions for me?
No.
All right. Now I'm gonna assess your lymph nodes. I'm gonna use two fingers, and I'm gonna use a rolling motion for those. This is your periocular. This is your postauricular. All right, if you can turn slightly, I need to see the back of your head. And your occipital is located in the back of your head. All right. Now I'm gonna look at your jugulodigastric. This is your submandibular. This is your submental. All right, in the back of your neck, we have your posterior cervical. And then on the side of your neck, we have your superficial cervical. And then here, we have your deep vein. All right. I'm also noticing, as I'm looking at your neck, that there's no bumps, lesions, or any any pulsations, and that your trachea is midline. All right, I'm gonna have you shrug your shoulders for me. I'm looking at your submandibular. All right, unshrug your shoulders for me. And did you feel any tenderness noted with that?
No.
Perfect. And that will conclude. I appreciate your cooperation. That will conclude your assessment. Today we did a general survey and an inspection of the head and neck of an 18-year-old male. He was alert and oriented ×3. He was able to give me his name and the president's name. His BMI was appropriate for his height and his weight. His personal hygiene was great. He didn't have any dirty clothes or any odors noted to him. I noticed he didn't have any walk with a cane. His gait was steady, his posture was straight, and his posture was erect. I started with his head. His scalp was clean, dry, and intact. His hair was black. There was no dandruff noted. He didn't have any tenderness noted when I palpated his head. Then I moved on to his frontal sinuses and his maxillary sinuses. I also then moved on to his eyes, which they were both noted symmetrical, no redness, drainage, or swelling noted. His eyes were reacted to light appropriately and the accommodation. His nose was symmetrical, no redness, drainage, or swelling noted. His lips were pink, moist, and intact. I didn't notice any swelling, drainage. Also, I palpated his ears. There were no tenderness noted, and his ears were symmetrical with no drainage, redness, or swelling noted. I then also checked his trachea, which was midline. I then palpated all 10 lymph nodes. There was no tenderness noted. And I also checked his thyroid, and there was no tenderness noted or no enlargement noted. And that concludes the assessment of an 18-year-old male.